In this lecture, we're going to put together a lot of what we've been talking about in this course in terms of how you can apply different research methods to estimate the need for treatment services and preventive services, and how research on the effectiveness of different types of services can be brought together to guide the types of services that become available to people who are in need of treatment. Estimating treatment need in defined populations should be a systematic process of using both quantitative and qualitative data to find out who's in need of substance abuse services. And the approaches include looking at social indicators, overdose deaths, for example, looking at population rates from surveys of prevalence of substance use and substance use disorders, mapping the current supply of services, looking at the demand for services, who's using services in different treatment facilities, who's coming into emergency rooms, and what the waiting lists are for treatment services and detox. We can also rely, using qualitative methods, on expert opinion, as well as combine all of these methods into one. And for practical purposes, since none of these is going to provide a definitive answer, multiple methods are probably the best approach to needs assessment. In this course, we've talked about system issues periodically, and looking at the system as a whole, as it evolves, and how it responds to increases and decreases in substance use and changes in substance use patterns is very important for needs assessment. System-level data can provide a way of estimating who should be getting initial services in primary care, for example. We can use system-level data from the general healthcare system as well as the specialized psychiatric and substance abuse system to find out who needs essential services. We can figure out, or we need to figure out, who can get care in the community through outpatient facilities. And we can use data collected in needs assessment to educate the public and to educate policymakers. If we just sit back and work in our treatment facilities, we may not be able to communicate sufficiently to policymakers to fund the programs when they're needed. And the collection of needs assessment data is often important for this purpose. We also need to involve communities and families and consumers. All of these stakeholders are important to get involved in planning services. The data collected can establish the need for national policies, for example, for the opioid epidemic, where we're going to be talking about not only the need for treatment, but the need to prevent abusive prescription practices and manufacturing practices by the pharmaceutical industry that have contributed to the dramatic increase in exposure. We want to be able, for needs assessment, to develop links with other sectors, criminal justice, for example, so that we can coordinate services better. And we can use this data to support relevant research and monitor service utilization. And finally, as you've been exposed to in our discussion of system issues, improving the equity, the efficiency, the effectiveness, the integration, and finally, the population impact of alcohol and drug services. Here is an estimate from a study, a needs assessment study conducted in the state of Connecticut that looked at all the people identified in a population survey using a structured psychiatric interview to estimate the rate of substance use disorders in the state's adult population. And of all the people who met criteria for a DSM substance use disorder, either substance abuse or substance dependence, we found that 62% of them had never been in treatment. Of those with a substance use disorder, 18% had past treatment or some form of intervention, so it's more likely that those people might, once they got to a very serious stage, go back into treatment. Another 17% were currently in treatment, and 3% perceived a need for treatment. So a large proportion of the people in a population who have a substance use disorder don't perceive the need for treatment, have not had past treatment, and are unlikely to be searching for treatment unless they get into a more serious stage of their addiction. Needs assessment can help to bring services to those people. Other objectives of needs assessment are to identify the pathways into the service system, identify barriers to services, describe the gaps between existing services and the distribution of substance use disorders in the population, whether it's by gender or ethnicity or age or other factors. And finally, needs assessment can also help to identify emerging drug epidemics. One such drug epidemic that is plaguing the United States now is the opioid overdose deaths that have been increasing since the late 1990s. And this graphic shows Connecticut compared to the US in general. And we can see that Connecticut is right in the middle, except in the past few years, the rate of acceleration of the epidemic has been greater, with more and more heroin and opioid pain medication deaths reported than the national average. Opioid overdose deaths through population surveys and the study of mortality data have shown us the population groups that are most affected by this opioid epidemic. And they happen to be pretty well equally distributed between young adults, middle-aged people, and older adults up to age 59. So we have an instance where the opioid epidemic is affecting all age groups. And we know that it is highly correlated with a flood of opioid pain medications that started in the 1990s to come into the market in the United States, and liberal prescription practices within the medical community. And what this has led to is a transition from opioid overdose deaths caused by heroin to deaths caused by prescription medications. And this started about in the late 1990s. We can't forget alcohol. And alcohol in the state of Connecticut has been highly prevalent. It continues to be so, affecting, in terms of alcohol dependence, about 5% of the population. And risky or hazardous alcohol use affects another 14%. The system planning needs for needs assessment include validated methods for measuring the extent, quality, and integration of services, which we've talked about in this courses, ways of determining whether current services are meeting population needs, the gap between people who have a disorder in the population and those who are already in treatment, and methods to demonstrate accountability, how we can identify the gap and persuade policymakers and treatment providers to change the ways that services are delivered. Unfortunately, Up until now, most evolution in our treatment services has been guided not by systematic needs assessment using quantitative and qualitative methods, but rather by ideology, fads, personal and professional preferences, rather than public health considerations. World Health Organization substance abuse instrument for mapping services, as you learn from your readings, can be used for needs assessment. It can be useful for describing a current system, evaluating the fit of the current system with population needs for substance abuse services, including gaps in services. It can be used for planning new services or reallocating resources that aren't being used efficiently, monitoring changes as the system develops. If the survey of the WHO-SAMES is repeated every couple of years, and comparative analysis across states or countries. The WHO-SAMES is a professionally driven way of collecting data on incidence and prevalence and the types of services that are existing within a treatment system, and putting that data together in a way to estimate the need for future services. Another emerging tool that's becoming available through research is a needs-based planning approach developed by Brian Rush. And Brian Rush is a sociologist and psychologist who has been very involved in treatment systems planning in Canada over the years. And the needs-based planning approach begins with the tier that is most available to people, the tier of our healthcare system, which is mainly general medical services, including primary care. And here we've developed a variety of services that can identify people early through screening techniques in primary care emergency departments and delivery of brief intervention, brief treatment, or referral to treatment. So the first tier is one in which people are encountered in general healthcare settings and given services that they need. And if no services exist or they're pretty arbitrary, then needs assessment can take the data that we've obtained from population estimates of prevalence rates of risky drinking or risky substance use, identify the people who are involved, and identify the existing services. And with the identification of the gap between existing services and the need, we can plan better services to identify people earlier and refer people into treatment. The next tier consists of emergency and critical services that are needed to manage people who are undergoing severe withdrawal symptoms, as well as chronic disease services in the medical care systems that handle the psychiatric and other disease conditions that they experience. And finally, rehabilitation services that come at different levels. And around the specialized system of services that have been developed, as well as the front end of identifying people at an earlier stage in general medical services, we now have what has emerged in this armamentarium of treatment services, internet and mobile-based services that provide supports to people in the community through social media and screening and outpatient treatment through electronic kinds of interventions, as well as the time-honored and very effective mutual aid resources like Alcoholics Anonymous and Narcotics Anonymous. Putting it all together, needs assessment can help us to understand where resources are needed in this configuration of the current treatment system. With that, I want to thank you for participating in this course. It's been great communicating with you all, and good luck in your future in research on substance use disorders.